Hello and welcome to the Hormone Genius podcast. Today we are going to be interviewing this lovely lady, Tessa Mills. Teresa and I are super excited to get to know Tessa a little bit and hear her story for our sake, but then also for the sake of our listeners. From the little that I've gotten to know Tessa, I just knew that this was a message that women needed to hear. So, Tessa, so you and Teresa have never met. You and I met like few weeks ago at the Tea Cellar, which is one of my favorite places in Cedar Falls, Iowa. And it was the first time I met you, and I heard about you from a mutual friend, and it just, your story was so amazing. So will you fill Teresa in and our listeners, just fill us in a little bit about just about yourself. Give us a little introduction.
Yeah, well, thanks for inviting me here. I'm really excited to chat with you both and share my story and my experiences. Yeah, so I am actually a public health professional turned fertility awareness educator. And my story really kind of began in adolescence, but I became really passionate about this work when my own charting practice helped me identify a thyroid issue that had been kind of swept under the rug for many years. I actually have no idea how long it might have been boiling over, but yeah, so when I was a teenager, I actually also had really irregular periods, and the go-to was, well, let's put you on birth control. And so I used birth control throughout most of my teens, and then most of my 20s, kind of on and off. And still, even when I would have bouts of time when I wasn't on birth control, I was still having those irregular cycles coming up. And I would always kind of question when I would go to the doctor, I'm not really sure why this is still happening, and it kind of concerns me. But I was always told, if you're not trying to get pregnant, irregular cycles really aren't important. This isn't really anything that we need to look into or be concerned about. And, I just took what my doctors told me, and I thought, well, they're the experts and they know best. But if I'm being really honest, there was always kind of a part of me kind of within my intuition that said, I don't know about that. There's something about that just doesn't sit right. That doesn't seem right to me. And really, it wasn't until I was in my late 20s. I think I was maybe 27 or 28. And I had met my now husband, and knew he was the one right away. And so I started thinking more about having a family. And those conversations kept coming back where I thought, gosh, I'm still having irregular cycles, and I'm still being told, oh, well, birth control will solve this problem and this problem and this problem. But I thought that's not really a sustainable solution. So what am I going to do when we decide to have children and I'm still having these issues? What will I do? And so it was at that time I decided to go off birth control completely. I decided to start charting my cycles, and I started teaching myself about fertility awareness. I did have a friend who had practiced natural family planning for many years, so I knew a little bit about it just from her information. And I found that the more I started charting and the more I started learning about this information, it was incredibly empowering. It was almost like for the first time in my life, I felt that I was kind of getting in touch with who I really am and being really confident in myself. And that was completely unexpected for me. But the flip side of it was I actually used fertility awareness for the first year for pregnancy prevention. And I absolutely loved that I was in control. I liked knowing where I was in my cycle and that I had that control. And then at the same time, I started, again, these irregularities kept coming up. And that was when I said, it is time to figure out what is going on. And so when I went to my OBGYN, I brought up these concerns again. I had my charts in hand. I had all this data and all this information. And I said, I'm not trying to get pregnant right now, but I would like to figure out what's going on. And she really tried again to discourage me from doing that. And I really felt like I really had to advocate for myself. And I did eventually get her to say, you know what, let's check your thyroid. Let's run a glucose test if we have to someday evaluate for PCOS. And then I did learn that I have Hashimoto's, which which is, for listeners that might not know, that's an autoimmune disorder that attacks your thyroid. And it made sense. I'm like, oh, okay. That's why I'm having all this, these issues. But for me in that moment, that was really what sparked my passion for this, because I realized that the way that we're approaching these things in medicine is so broken, and we're really using Band-Aid solutions to cover up when our menstrual cycles are off. They're trying to tell us something. They're trying to tell us that something underlying is going on. And the other thing I realized in that moment was that it almost was as if my health wasn't important unless I was trying to have a baby. And I felt that that was very wrong, because a lot of women do choose to not have children. And so what does that mean for someone who never wants to have children? Will their health ever be considered valuable? And I felt that that was a huge problem. And really that was how I got into this work.
Wow, Tessa.
Yeah, awesome.
Something I didn't say at the very beginning, even for our listeners, is we want to interview people, women specifically, with these stories to share, because huge impacts and movements are made when we hear other people who have similar story to our own. So anyway, I wanted to say that too. These stories are so important. And Tessa, thank you. This is a really important part of what Teresa and I are trying to do with this podcast, is to make sure people have a voice, women have a voice, and that people know they're not alone. But what you said made me think about Teresa and the work she does. Tessa, you might not know what Teresa does for work. And Teresa, maybe just introduce yourself just for a brief moment for Tessa so that she knows your job. And then we can start that conversation between healthcare, true healthcare, versus what we're being fed as women in society today.
Well, thank you. Yeah, Tessa, everything that you said, I mean, even though I'm in healthcare, I'm like, I still go back to my teenage self and my 20-year-old self. And I feel the same things you felt. And it's just so frustrating that, you know, we don't have access to this, these young women, to just understand our bodies, and how different would it be in terms of our health if we could have a starting point of knowing who we are. So everything you said just spoke volumes to me. So that is a beautiful story. But I am a women's health nurse practitioner, and my whole practice is basically helping women like you. Except that if you would have come to me like way back when you first had these problems, you know, I would have addressed it completely differently, because I actually took the approach in women's health that I wouldn't ever prescribe birth control. It was a weird kind of, not weird, but as I was going through my nurse practitioner training, I realized that, oh my gosh, like they prescribe the pill for everything. And then when I would ask, like, well, what do you do if someone doesn't want to be on the pill? And my professors would be like dumbfounded by the question almost, you know, and you're right. Like, why, when I think about a doctor going to medical school, isn't the starting point like you're the detective? If you're a doctor, you're the detective. Your job is to discover what went wrong in the body. And for women, that's not happening. What's happening is if you don't want to have a baby in that moment, they look at you as something that's like, oh, no pregnancy, birth control. Which birth control would you like? Oh, I'm sorry, you have problems? Well, good, I got the fix for that. It's still birth control. And, you know, again, you had a true, actual health disorder that was probably masked over for many years. And Hashimoto's thyroid causes lots of symptoms that decrease your quality of life, which I'm sure you had. And I think about my sister, she had a thyroid problem undiagnosed for years as well. Same thing, went to an OBGYN at her college. Oh, you're in college, you have irregular cycles, well, let's give you birth control. And she was tired beyond belief and gaining weight, and nobody ever looked at her. It's like we're not being seen as women, and that's just so unfortunate. So my whole practice is helping women like you find what the underlying root cause is and giving you an option for treatment that is not birth control.
Tessa, tell us, like, okay, so compared to then versus now, then on the pill, off the pill with thyroid issue, because would you say that your thyroid issue has been addressed now? I mean, you're getting the treatment? So explain how you feel now compares to how you felt before.
Well, first of all, when I found out that I had Hashimoto's, I said, okay. I mean, it was like it clicked. It all made sense.
Like,
because Yeah, well, actually, in the year prior, I felt horrible. The year prior, before I was really starting to chart and learn this information, I was getting concerned because I was approaching my wedding. I was gaining weight rapidly. No one wants to be a heavy bride. I mean, I was doing CrossFit at the time, and nothing was working. I was exhausted. I felt like I needed 2 or 3 naps a day. My skin was really dry. I mean, beyond anything a skincare product could resolve. And I asked at my annual exam the year prior, something is still off. I don't know why I'm feeling this way. And I was at the time told, well, you're approaching 30 and your metabolism slows down. So this is just, this is kind of normal. So, and one thing I'll share with that, Teresa, you mentioned, women are not being heard. Early this year, I put together just a brief survey. I just found myself really interested in, I knew what my experiences had been, and I was interested to hear from other women and what their experiences were around, menstrual cycle issues and birth control and healthcare. And I just put together this really informal survey. I mean, I made it in Google Drive, and I shared it on my own personal Facebook page and in a few groups I was in. And I think I had about 143 women respond to the survey, and they shared their experiences. And when I looked through all the responses, and granted, everybody was coming from different, perspectives, but the number one theme that came out of that survey was every woman had some experience of not being heard, of not being listened to. And it just further emphasized that there's such a gap in our healthcare right now with this. And it's sad. It makes me really sad, to be honest.
It's very sad because I think we're led to believe that, women have been given a lot of freedom through access to birth control, but there's this kind of weird ironicity that in the whole world that birth control has developed to give women access to family planning, we also have been told now nothing else matters. So, we deserve the whole thing. We deserve holistic health. We deserve the ability to plan our families without having to take hormones that could potentially hurt our body. We deserve that choice.
Yeah.
And we're kind of told through the culture and all the people around that that's not really an option. And that's why people get very passionate about this, because they have a story and they want to share with women that there is more. There's more than just walking into an OBGYN and being told, this is all I can give you.
Mm-hmm.
I am all about informed consent and presenting there is a multitude of options available for you. If preventing pregnancy is your number one goal, let's look at all the options. If someone would have told me 10 years ago about fertility awareness and the benefit of the practice, I would have been 1,000% on board. But my options given to me were so limited. And again, I, along with a lot of people, just trust what their doctors are saying and that they're the expert and that they're the ultimate, decision maker in that process. And I feel like women are just not being involved in that decision-making process. And I feel that that's wrong.
Mm-hmm. Totally. I love the saying, we're not really choosing if we're not being given all of our options. And I think that's so true in this case. What woman actually chooses? No one wants to really take a pill every day. No woman really wants to feel the side effects of birth control, of the synthetic hormones. It's the only thing they know as an option. Women don't actually want that. And so I love that what you said, Tess. I think it's so important, especially for our doctors to know and understand that women who are given the full spread of information, many of them, like Tessa said, 1,000% yes, would choose something more natural. 1,000% yes. And I can imagine there are so many women just like you, Tessa, that would hands down choose something that does not alter them to then practice something more natural. And not only that, but getting to the root cause of whatever may be ailing them, which is what I love as a fifth vital sign of health, is tracking your cycle. I love that. Tessa, I also love how you took it upon yourself to say, I'm going to dig into this and I'm going to create a survey I'm going to ask people, and that 100 and how many do you say? 104?
43.
143 women, you post on your own page, 2 groups, 143 women willingly took time out of their day to fill out the survey, and they may or may not have even known you because they felt it was so important to share that story. That means that there's a gap. I think that's so awesome of you to have done
There's
that.
definitely a gap. And then after that survey, anybody that had left, given me their email, I actually sent a kind of a follow-up message, and I said, I'm going to do some focus groups. I just kind of want to talk to people. And so I did a few focus groups where we met virtually on Zoom, and people shared a variety of experiences. And I remember one woman telling me, she said, how many people did respond to this? And I said, about 143. And she said to me something I'll never forget. She said, I think you had such a great response because nobody's talking about this. Women aren't being heard. And so when they're given the opportunity to share these stories and not be sort of gaslighted, so to speak, they're going to take that opportunity. And that stuck in my mind because I felt like by doing that, I kind of opened, what do they call it, Pandora's box to all these other issues that I wasn't even aware of. One thing in particular that stood out that I did not know was happening in healthcare, a lot of women who get IUDs or long-active reversible contraceptives are having problems finding healthcare providers to remove them when they're having issues like pain or bleeding. And they're on top of it, I heard some really troubling stories from women that were then not only having issues with their IUD with bleeding, but then they were being prescribed birth control pills to take on top of these IUDs. And Teresa, I don't know if you have anything to add to that from a healthcare perspective, but that was something I had never heard of before. And that scared me a little bit.
Yeah, it's really disturbing, and goes against everything that really is pro-woman, you could say. But no, Tessa, you're right. I mean, I've had patients tell me, like, they ask me to remove their IUDs because their doctor told them they wouldn't. And they'll say things like, oh, well, you've only had it in this long and you paid this much for it, so you got to try it for longer. Almost like you didn't get your money's worth out of it, so I'm not pulling that out. It was too expensive to put it in. Or they just, almost this attitude of, well, you're just going to get pregnant if we pull this out. And so, like, again, the whole, you don't control your body, we're helping you control it for you attitude. And that's also very anti-woman. And so you do hear those stories. And yeah, I find it very disturbing when women are already on synthetic hormones and then you're dumping more on top of them. And I can guarantee you, women don't feel good. You maybe think you're fixing some pain or bleeding problem, but they are not feeling well when they're amped up on synthetic hormones. So, that's not across the board, but those stories are definitely out there. And again, Tessa, you're someone who probably naturally is more inclined, I would think, to advocate for yourself. But there are so many women who don't feel empowered to advocate for themselves. And I often say this to my patients: listen, I'm here for you. Like, if you don't advocate for what you think is best for you and your body, and you don't tell me those things, I really can't help you. Because, I mean, in making decision treatments for my patients, I want them to basically be a part of that decision. They live in their body. I don't live in their body. And so a woman needs to know it is your right. It is what you deserve to advocate for what you think is best. And if someone tells you, I'm sorry, I think I know better than you and what you know, then you walk out and you say, I'm gonna go find someone different. Because there are people out there that do listen, that do care, that do want to help women at any stage of where they're at in this journey. And again, all women do deserve that.
Absolutely. And that is one area that I'd really like to incorporate when I get my certification as a fertility awareness educator and I start working with clients. I want that advocacy piece to be such a huge part of it. I have no problem advocating because I'm an authority questioner and I question everything. But I know that can be challenging for a lot of people. And that is the number one thing I want to instill with anybody I educate or anybody I work with, is that you have the right to, at minimum, ask questions. Question, why are we doing this? How is this going to benefit me? What are the pros of this? What are the cons of this? You have the right to have that information. But I do think that's a really challenging, I think that's really difficult for a lot of people. You're right.
Tessa, explain here what leap you just recently made. I would love for our listeners to hear that, just like that faith and that conviction you have to even change your life around this whole thing.
Yeah, so I actually left my full-time job. I worked full-time in public health, and wasn't miserable at my job, but it wasn't work I was super passionate about. And I actually, when finding this and kind of going through this my own experience with this and seeing the need and seeing the huge problem that exists, I became so passionate about solving it that it led me to leaving my full-time job and starting to do this work full-time, because I saw such a need, and I wanted to wake up every morning excited to be doing this work. So yeah, I went for it. And I am incredibly privileged in the fact that I have an amazing husband. I have a very supportive partner who completely was like, go for it, honey. Like, if this is your passion and this is what you want to go do, I support you 110%. So yeah, I'm really excited. I actually next week I start my certification program with FEM. So I'm going to be doing FEM certification, and yeah, and then launching my programs and services in 2021. So I'm excited.
That's awesome, Tessa. Okay, so Teresa, do you have any questions before I ask her the last question before we wrap up?
Okay, does your last question, Jamie, have to do with the call to action?
Well, no.
Okay, because I'm going to ask a question about that, because I can't remember what your last question is then.
Okay, so.
Yeah, I mean, we, like, on the podcast, oh, sorry, were you going to say something?
I was going to ask her the question, but you can tell her. You can fill her in. Yeah.
Well, yeah, we always are trying to, like, again, leave our listeners with a call to action, which you've given us already a lot, because you're saying, women, go out, empower yourselves with information, knowledge about your fertility, advocate for yourself, which is amazing. And just knowing to listen to your own body. If you think something's wrong, then tell somebody, and then don't stop fighting for yourself. So all of those are great call to actions. But in your own words, Tessa, if you had a call to action to women listeners out there, like, what's your pitch? Like, how can we, like, inspire women to really get passionate with us about women's health and about fertility?
I think overall, my call to action to all women, regardless of where you're at in your journey, whether you want babies, whether you never want babies, is to recognize that your menstrual cycle is really a blessing, a vital sign. And to, when something is wrong, to completely lean into your intuition, and that you are the expert of your own body. Someone with a medical degree does not get to tell you what is right and what is wrong to make decisions. And that I really, just my call to action is to go empower yourself with this information, go find support from people that are willing to help you to get answers to your health concerns, and to really just lean into that you are the expert in your own body and your own health.
Love that, Tessa. You know what? That's perfect, because my last question was, what do you wish every young woman knew about their hormone genius or their cycle? So would you say that same thing applies, or what else would you add, if anything? What do you wish every young woman knew about their cycle / their hormone genius?
I would tell every young woman that your hormones and your cycle does not need to be pathologized. Your hormones and your menstrual cycles give you incredible power. as you progress through your menstrual cycle, you know, you as your hormones cycle through, you've got different strengths and different abilities during each phase of your cycle. I wish I had known that when I was young and in my early 20s and struggling with anxiety. And I wish I had this knowledge, and I wish I had the skills and the tools to chart my menstrual cycles and to know exactly where I'm at in my cycle, so that when I'm having days where I'm tired or I'm a little bit more introverted, to not pathologize that and think, oh no, am I having an episode? Am I depressed maybe? But recognizing that maybe I'm in my luteal phase. Maybe I need to allow myself some downtime today, and to just lean into that, because I think that's another issue that I have, is that I think we live in this culture where, you know, we see all these ads for, you know, mental health drugs, and I'm not opposed to mental health drugs at all, but I just feel like a lot of people really want to treat those things away, when sometimes maybe it's just a matter of paying attention to our hormones and where we're at, and that sometimes it's okay to feel withdrawn, and that's just part of having a menstrual cycle and having female sex hormones.
Yeah. Tessa, that's amazing. In episode 9, we will be talking about the feminine superpowers. So yeah, our listeners got a little taste there from Tessa, but we'll be learning more about like our tendencies, their skills and abilities throughout the phases of our cycle. So you kind of touched into that too. So yes, for those of you interested in learning more, check out episode 9, because you'll learn more about that too. But that's amazing, Tessa. Very, very wonderful. Thank you for spending your time with us today. It's so fun even listening to a second time explain that. I just had a blast. And if you would like to learn more about Tessa, will you share with them maybe your Facebook handle or ways to stay connected?
Yeah, you can actually find me on my website. It's empoweredcoaching.com. It's spelled EMPOWHERED, empoweredcoaching.com. And you can also find me on Facebook at Empowered Coaching.
Awesome. Well, thank you, Tessa. Do you have any other thoughts here before we close up, Teresa?
No, thank you so much, Tessa. That was really awesome. And I know you've inspired a lot of women listening. So thank you for being our guest on the Hormone Genius podcast.
Yeah,
yes, thank you for having me. It was so much fun.
Yep. So for those of you who are listening and would like to learn more, be sure to subscribe to our YouTube channel. If those of you don't know that we have a YouTube channel, you get to watch us as we talk. So subscribe and like our YouTube channel, follow us on social media, and be sure to share this with your friends, because every person deserves to know this information. Every woman in your life, and you deserve to know this.